So at this meeting I'm presenting an abstract on the cost effectiveness of Venetoclax plus Obinutuzumab in comparison to a variety of other regimens that have been developed for the frontline treatment of CLL. I think this is an increasingly important question because we have lots of new tools in our toolkit to treat CLL, but many of these are novel agent-based therapies that are quite expensive, and so I think we need to figure out what is the relative cost effectiveness of all these different regimens, particularly with the idea of trying to define the economic effectiveness of a time-limited treatment approach versus a treat-to-progression or continuous therapy approach. So in our study we compare the cost effectiveness of Venetoclax plus Obinutuzumab given as a one-year time-limited regimen in comparison to some chemoimmunotherapy regimens which are also time-limited, but I think perhaps more interestingly to treat-to-progression regimens like ibrutinib as a monotherapy or ibrutinib in combination with CD20 antibodies. What we found, even with a 3-year time horizon, is that 1 year of time-limited Venetoclax plus Obinutuzumab is significantly more cost-effective than these treat-to-progression regimens, because each year these novel agent-based therapies have additional costs if we continue to give them, and the durability of response so far with Venetoclax Obinutuzumab suggests the possibility of a treatment holiday where patients can be off drug, which can lead to cost savings. So this is still a fairly preliminary analysis. I think we need to see what the longer-term follow-up is, both of the studies as well as the economic analyses, but I do think this is the type of study we need to be doing to try to help decide what the optimal therapies are for our patients.